Hello, my name is Bozada. I'm here at Hosmer Chiropractic Health today to discuss some overhead squat technique. We've been doing a mobility series here at the clinic, and we're kind of just tying some things together right now and applying it to the complex movement of the overhead squat. So a good starting point would be the grip. So what I usually have athletes and clients do is take their barbell, like this Rogue one here, or their PVC pipe if we're doing technique work, place it right in the crook of their hips, and then press their hips back with the PVC pipe. So whether it's a barbell or a PVC, it will stay in the hip joint. I then have them reach their arms out, full extension, twist the palms down, wrap the thumb into a hook grip, and that's your snatch grip. What that does is it puts it right below the hip bone and right in the middle of the pubic bone where there's a little bit of fatty tissue there. That's exactly where you want it. Okay, and from here, what we're going to do is if you're coming with a PVC pipe from the hip, we're just going to bring the bar up. From here, we need to have good squat mechanics with the legs, so we're going to have our feet at least shoulder width apart. We're going to have the shoulders set down, scapula retracted backward. Okay, so you want to keep that scapula against the ribs. Okay, and then from here we're going to have constant energy pressing through the knuckles to the ceiling that keeps our arms locked out. Some common faults here are that people want to internally rotate the shoulders. Okay, that's not going to be stable when you're in the overhead position, especially when you apply weight. Another fault is that people don't extend the elbows. This is also not stable. Okay, and another one is that people really extend through the cervical spine here in the neck, and what that does is it causes a little bit of nerve irritation and blockage, and you might notice some symptoms of numbness, tingling, and sensations like that in the fingers and hands. So in other words, we want to keep the bar right overhead, preferably in line with the ears, chest up, hips underneath our body, and then we're going to set the hips slightly back, maintain vertical torso, knees go outward over the toes. Once we're in the bottom, we're going to push through the heels, activate VMO, which is the vastus medialis oblique. That stabilizes the knee while we're using the glutes to press the knees out. So we've got inward support and external support. Press through the heels, come to the top. Another note is to keep the ribs down. That's another fault, is people flare the ribs. My bar goes behind me now, and then I also sacrifice my back. So that's something else to pay attention to. We're going to now go through full range of motion with weight, with a side view. So from the side, what you should notice is that I'm trying to drop my hips as vertical or axial downward as possible versus this, shooting the hips backward. Okay, my heels are going to stay flat. My toes will be slightly externally rotated from the hip down, and my knees will glide out over those toes. So, snatch grip on the bar, come out of the rack, shoulder width apart, chest up. We're going to push press, lock out the shoulder blades. My elbows are locked, chest up, ribs down, slowly descend. I'm not letting my tailbone flare out. I'm keeping everything balanced and upright. And from here, I'm going to push through the heels, activate VMO, stabilize, and finish the repetition. We hope this helps you and assists you in your overhead squat endeavors. Thanks for watching.